guys a little bit of tips and everything on how to study for your antibiotics. We never got to go over this, so I'm just going to go over it with you guys. I have 9 pages here that I'll go over with you. So I put here your ATI pages. It's just like an overview, but I'm going to hit all the main points after this. So if you want to read through it, you can read through it, but we're going to hit all the points after this as well. So yeah, this is going to be really important for your quiz. I mean, it's not going to be a quiz, it's going to be your final, but this is going to be really important. You have your 6 tips of antibiotics. You have your information that you're going to have to tell your client if they're taking an antibiotic. So you have your 6 tips you need to educate your patient on. So these are the things you need to tell your patient. Number 1 is going to be your most important tip here. The other ones are important, but this one came up a lot, I remember. So you're going to educate this client to finish their medication. Antibiotics are used for 2 months, 3 months. It depends on what type of bacterial infection this patient has. Maybe they're even just taking it for acne. I even took an antibiotic for acne. That was for, I think, 3 months. So even if they're taking a medication for bacterial infection or acne, you want to educate them to finish the whole medication, especially if they have a bacterial infection. You tell them just because you're feeling better doesn't mean you should stop taking the medication. Keep taking the medication, finish the whole entire course. They need to finish the whole entire course, because if they don't finish the whole entire course, they can end up with something called a super infection. And what a super infection is, it's basically like we have normal bacteria within our body, even right now. And if we stop taking this medication abruptly, we don't finish the whole entire course, this normal bacteria within us can move and invade other tissues, and this can cause in bacterial infections, and especially infections like C. diff or MRSA, or even like a yeast infection. So that's why you're going to educate the patient to finish the whole entire course. Okay? So again, antibiotics, they can be given for 2 months, 3 months. It just depends. But you always educate them, finish the whole course. Don't just stop because you're feeling better. So that's going to be your first tip. Don't forget that one. That one's really important. I remember that came up on quizzes. So just remember that one. Next is that accidental pregnancy can happen because oral contraceptives become ineffective. And by oral contraceptives, that means like if the woman is on birth control, that can become ineffective, especially if they're on a cyclin or like a penicillin or like a doxycycline, which I'll go over those medications with you guys. But it's important to educate your clients that if they're on a doxycycline or like a penicillin, they should use contraceptive, like condoms, things like that. Just because those birth control can be ineffective. All right, so that's that one. Next is no alcohol. So antibiotics are very hard on the liver through metabolism and things like that. But we also know that alcohol is also very hard on the liver. So you don't want the client taking 2 things that are going to be really harmful to their liver. Okay? So that's the third one. And then the fourth one is no food. So with certain antibiotics, this patient should be taking it on an empty stomach with a full glass of water. So that includes like your tetracyclines, your macrolides, like your macrolides are the ones that end in thromycin, then your cyclins, and then your fluoroquinolones, which we'll all go over those as well. So it depends. Some of them they need to take food with, and then others no food. All right, which we'll cover. Next is no sun. So some of them also cause photosensitivity, so that the patient's really sensitive to sunlight. They get like their skin reaction, sunburns, things like that. So they should avoid direct sun exposure, or sunburns can happen. So with photosensitivity, you always want to tell the client, wear a sunscreen, wear a hat, wear long sleeves, things like that. And that's going to be like your fluoroquinolones, tetracyclines, or like your sulfa antibiotics. If you remember from the past, when I've ever talked about other medications, sulfa drugs are contraindicated, and especially happens with photosensitivity. So that's a little bit about that one. Sixth tip is there are some medications that are extremely toxic to the kidneys and the ears. So that includes vancomycin. That's a really important one. Do not forget that one, as well as gentamicin and neomycin. Um, so basically, it's really toxic, so it can cause ear damage, which is known as ototoxicity. So the client can have vertigo, which means a loss of balance. So our ears, hearing and everything goes hand in hand with our balance. And then also tinnitus, which is ringing of the ears. So they can also end up with that. So you want to pay attention to that. Um, and then also kidney damage. So some of these antibiotics are nephrotoxic, so you want to report immediately. So this is when our kidney labs come in again. So those blood levels, those blood lab levels, and as well as those like urine output. So we always know creatinine over 1.3. That's telling me that something's up with the kidney. BUN over 20 or even a BUN over 30, we would be like susceptible of something happening within the kidney. And then this always goes for everything. So urine output, 30 milliliters or less an hour, you're going to be alarmed. So a patient should always be putting out 30 milliliters or more an hour. If they're not, you're going to want to think that something's up with the kidneys. All right. Next up, this is like sort of just like a table of contents for you guys, main things to focus on when it comes to these antibiotics. So I'm not really going into it yet, the antibiotics, but this is sort of just like a little table of contents, the main things you should really just like be paying attention to, and how to really differentiate these antibiotics. So you have some broad spectrum. So this is going to be like your Cillins or your Ceps. And these medications they're broad spectrum. They're safe for pregnancy and breastfeeding. Allergy to Cillins. A lot of people are allergic to penicillin, so you always want to make sure that they're not allergic, things like that. I'm allergic to penicillin. I found out when I was taking it. So sometimes you find out when you're taking the medication. I broke out in hives. It barely could like walk or anything. It was just like a whole body reaction happening. So sometimes, the only way to really find out if you're allergic to it is if you tried it. If you tried the medication and a reaction has happened. So you always assess the type of reactions first before giving a Cep or Cillin drug. All right. You always want to see how that's going to happen. So with your penicillins, you're going to watch with oral contraceptives. So that means like birth control that the women are taking. That can make it ineffective. So we always want to educate the patients on that. You would tell them, to wear condom. You would tell them for their partner to wear condoms. And then they should take with food. So this is one of the medications that you should take with food. Shake well. You can take penicillin. Can come liquid as well. And then it also has a side effect of bleeding. So you want to watch like that clot time of that ANR, APTT, things like that. Next, your Ceps. These can cause C. diff, but does not treat C. diff. So if you think back to like fundamentals when you learned about C. diff, so C. diff is that bacterial infection that causes clients to have this like diarrhea, but it's not even like diarrhea. It's like this really watery diarrhea, and they just keep defecating this watery diarrhea, and it's like nonstop. They like lose a lot of weight, they lose a lot of fluids. So with patients with that, we always want to monitor like hydration status, things like that. All right, just to check for that, because C. diff is associated with clients just losing a lot of fluids, so they become dehydrated. So something you want to assess for is hydration. But this one can cause C. diff. Note that, because some medications treat C. diff, some antibiotics, which we'll go over. I believe that one's metronidazole. Let me just make sure. I just want to make sure, so I want to say the wrong information. Um, mm, yes, so some medications treat C. diff. Your Ceps are going to possibly cause it. Um, so that's a little bit about that. And then take food if GI upset. Yeah, so with some of these antibiotics, you tell these clients to take food or GI upset may occur. Like I was on doxycycline and the nurse practitioner who prescribed it to me told me to take food while I'm taking this medication just because if I don't, GI upset will occur, like nausea, which I did experience. I like didn't eat enough food before, so I took the medication and I had a lot of nausea and I felt like I had to throw up. So that's why you want to educate clients to take food with some of these antibiotics. Um, just so that nausea and vomiting doesn't occur, and that's what they mean by GI upset, that nausea, coming up and things like that. With your steps, you have a side effects of diarrhea. That's common though, nothing to like worry about. There, okay, yeah, it is common to cause diarrhea, but if it's becoming really watery diarrhea, you're gonna want to like suspect C. diff, and then you want to be a little bit suspectable with that. All right. Next up, we're going to go over these highly toxic antibiotics. So that includes like your mycins, um, use. We're going to use these like really strong antibiotics to treat C. diff as well as to treat MRSA. MRSA happens when patients don't really like wash their hands, things like that, just not having good like hygiene practices. That's usually when that happens. Um, So the main thing with these mycin, so these are your medications that end in mycins, okay? Those are your suffixes, okay? So they're really toxic to the kidneys, the ears, and the liver, okay? So you want to monitor peak and trough levels 15 to 30 minutes before giving because you always want to make sure that the past dose is out of the system before you give more, just because then it's going to become like even more toxic because you don't want to make it even more toxic to the kidney, ears, or liver. Okay, that's why you look at the peak or trough. Um, and then you're going to want to monitor for signs and symptoms of toxicity. So with the kidneys, if you have an increasing B1 greater than 20 or creatinine greater than 1.3, okay, we measure those via the blood, and then a decreasing urine output less than 30. Okay. You would be like suspectable of something going up with the kidneys. And then ears. You would monitor for vertigo. Remember those balance problems. And then tinnitus is that ear ringing. Okay. Very strong. So you want to monitor that IV site like every 30 minutes. And you're going to want to monitor the IV site for like burning. Is there redness, erythema? Erythema means like redness. So just know that vocab word can come up. Um, redness, warmth. Is there any like edema, swelling, things like that. So you monitor that IV site because it's a really strong antibiotic. Glycopeptide. Um, so that's going to be like your class, but the drug name is vancomycin. This is a really, really, really important drug. You're going to need to know this one. This one's associated with red man syndrome. A way to remember it is saying that the red man is driving the van. That is like a little like saying to help you remember that vancomycin is associated with red man syndrome. It's not deadly or anything, but it's like a sudden onset of a rash, flushing within the face, or redness within the face, and hypotension. And you're going to want to avoid this by doing like a slow infusion for about an hour. And then you have aminoglycosides. That's in your class, but the drug itself is gentamicin. So this one is very toxic with vancomycin. So you're not going to want to give these two together because they're really strong. But this one is different from vancomycin because there's no red man syndrome that can occur. All right. Next up, you have your thromycins. Big liver toxic. A way to remember is saying that it's going to throw the liver away, throw the QT interval away, things like that. So big liver. So you want to watch those liver labs like the AST and ALT. So if it's like increased, you would be you would be sorry, not a little alarmed. You would be alarmed that something's up with the liver. Something's up with the liver. Um, and when the patient is taking Tylenol. So if you guys didn't know this, Tylenol is also very liver toxic. It is associated with hepatotoxicity. I remember that came up on a quiz and I didn't know that, so I had to like full on like guess. So Tylenol, if you've ever taken Tylenol, just know it's very liver toxic. Hepatotoxicity is that vocab word you should know. Um, Something to watch out for. So yeah, throw the QT interval away. Dysrhythmias, cardiac arrest can occur. This one you're gonna want to take on an empty stomach with a full glass of water. So no food, okay? So you just want to pay attention to which ones you can take with food, which ones not to take with food, things like that. And this one targets mainly gram-positive bacteria, but can go after some gram-negative. Don't really focus on the gram-positive, gram-negative of it. Don't really look into that too much. I just want you to focus really on like the side effects, and patient teaching, that and adverse effects. That's what you should mainly be focusing on here. Then you have your cyclins. So you have like tetracycline, doxycycline. So this was a medication that I was on for acne. So yeah, this is a medication that can be given for lots of different bacterial infections, but could even be used for patients who have like acne. So it is teratogenic. That just means that pregnant woman cannot take it. Okay, note that. As well as tooth discoloration within fetuses as well, like if she's pregnant. Avoid the sun, so phototoxicity. So this is one of the ones that have phototoxicity. So when taking no food, you want to take it with an empty stomach with water. Um, and then no calcium and iron. That's going to block absorption. And then you want to sit up 30 minutes after taking. So, my sister was on this medication and she used to like lay down after taking the medication and she ended up getting GERD. It just like it can actually like some medications can just cause GERD and it cause esophagitis, so inflammation of that esophagus where it can like burn on the esophagus where the acid goes up. So it can just this antibiotic can mess with that and cause GERD or like heartburn, things like that can occur. Um, I'm just gonna take 1 second. Okay. Just note, just because like um when I was taking doxycycline, I was informed to take it with food. But I just looked it up. It says that with sorry. It says with higher doses, you can take it with or without food, but you'll feel less sick if you take it with food. So it's like up to the client, like if you want to take it with food or not take it with food, but higher doses, you'll feel better if you take some food with it. Um, but yeah, so I guess it just depends on if the dose is higher. So just take that into mind, but I don't think I've ever had like a quiz question asked to take it with food or not food. I'm just gonna scroll down a little bit here just so I can take a little look. Mm, mm, mm. Yeah, so honestly, just know that with higher doses, you should take it. You can take it with or without food, but sometimes you can feel a bit better if you take it with food. Just depends on the person. Um, so that's that. No calcium or iron. I believe no dairy as well. That can block the absorption of the actual drug, so the drug won't actually be able to work. And yes, like I said, sit up 30 minutes after taking. You don't want esophagitis to occur. So it's like and that can cause like bleeding of the esophagus, things like that. We don't want those complications. And then you have your UTI meds. So you have sulfas. So this stops your sulfa, stops folic acid synthesis, so folic acid production. It is teratogenic, so pregnant woman can't take it. Avoid the sun; it has phototoxicity. Watch for crystals like within the urine, and that means that there will be an increase in specific gravity. So remember what specific gravity is. That is just a measure of how many solutes are within the urine. So you want to measure that. Is there crystals in the urine? What's the solute? Things like that. And your normal specific gravity is going to be 1.003 to 1.03. And then you want to encourage water and folic acid. And then you have fluoxetine. So you tell the client to avoid the sun, so phototoxicity, take with water, no food, report muscle pain, increased risk of Achilles tendon tear. Mark that down. That's really important. Sounds like a quiz question. It sounds really familiar. Um, so write that down. And then you have phenazopyridine peridium. So I remember this came up with MedSurg. This was when I was doing the tutoring for MedSurg for kidneys. This was one of the medications. I think it was on your outline. So this is not an antibiotic. It is supportive care. It is an analgesic. An analgesic is what helps with the pain. UTIs are extremely painful. So this medication is going to help with that pain. All right. So it's normal. It can cause like, don't be alarmed if like you wouldn't be alarmed if the patient comes in and says, "Oh, I have orange urine." That's normal. And then you want to watch for any jaundice, hepatotoxicity, things like that. Next is metronidazole. So this medication is important because it helps treat C. diff as well as sexually transmitted infections like gonorrhea, chlamydia, syphilis, things like that. Always tell these clients to avoid alcohol during 3 days after treatment. Again, you don't really want them on alcohol and these medications to begin with, because a lot of these are really toxic to the liver. Normal is brownie or red and a metallic taste. Bad is a new rash, skin peeling, and if you remember, if like I talked about in the last session, Steven-Johnson syndrome is like the skin rash, red skin rash, that some medications can cause. So you want to watch out for that. Next is an antifungal like fluconazole. So we use this for patients who have like candidiasis, like a fungal infection. But we can also use this medication for, I believe, impetigo, which you'll learn in pediatrics, this infection, bacterial infection, where there's like a lot of like crust around it and things like that. This medication helps with that. You watch in pregnancy. It is heterogenic, so only given when benefit outweigh risk. That usually goes for a lot of medications. So, like, if the benefits outweigh the risk, then you'll give the medication. But it just depends on the client. So, yeah. And then side effects, GI, as well as liver toxicity. So, you watch your LFTs, your CBS, your renal labs, things like that. Again, most of these are really liver toxic. So, that's why we said no alcohol. Okay. Now we're getting to like the goods of it. All right. Antibiotics, you have your nursing care. I want you guys to really focus in on this. This is really important. So with your nursing care, you want to check for allergies and possible drug interactions. A lot of clients are allergic to penicillin. So that's why you want to make sure that they're not allergic to this antibiotic. Some patients can be like really severely allergic to it. So that's why you want to check. And also possible drug interactions, okay? And then you also want to obtain cultures, blood, urine before starting antibiotics. This is really important because you need to know what bacterial infection, what bacteria this client has before you even prescribe or even a antibiotic can even be prescribed. You need to know what bacteria they have before you can say what antibiotic they can get. Because like I said, there are some antibiotics that are very, very strong. So really strong, very serious bacterial infections are going to need that vancomycin. They're going to need that gentamicin. But if it's not like a severe bacterial infection, we don't have to do those really like strong ones. We can do like a little bit of a one that's like a softer one. So it just depends. You need to know what bacteria you're treating before you can even prescribe an antibiotic, before the provider or the healthcare provider can prescribe the antibiotic. All right. So it's up to you as the nurse to obtain those cultures, the blood, the urine. So just keep that in mind. So say like a doctor prescribes an antibiotic, but you didn't even get to do the cultures yet. You're gonna say something, okay? Advocate for the patient because you always need to know what bacteria you're treating first, okay? Before that antibiotic even prescribed. So it's a little bit about that. Patient teaching, this is really important. So, like I said earlier, they need to finish the entire course of this antibiotic, even if they start to feel better before completion, because we need to prevent super infection like C. diff, MRSA, yeast infections, things like that, as well as medication resistance. Okay. You also want them to report significant side effects to the provider. So, new onset of diarrhea may indicate the presence of C. diff. Okay. Like I said, C. diff is that bacterial infection that causes like watery, like I mean watery. I'm sorry, not to sound gross, but like it's really watery diarrhea. And the clients, they just lose weight really fast. Hydration status you have to look at because these clients are at significant risk of becoming dehydrated. So if you notice that there's a new onset of diarrhea, you'd be like, oh, are they um, getting C. diff? You want to be suspectable about that because if they're not finishing their entire course, they're at risk for C. diff. Okay. Complete periodic lab testing if ordered. Mm-hmm. Periodic lab testing is important just because you want to monitor liver labs, you want to monitor kidney function, like the BU and the creatinine, as well as like the liver function, like AST, things like that. Um, you want to keep track of those organs because you don't want them falling off. So that's why we do those periodic lab testing. And then some antibiotics may decrease the effectiveness of oral contraceptives. So by that I mean like um, birth control. Um, yeah, so oral contraceptives, so like the pills that these women are taking, birth control, can become ineffective. An alternative method of contraception may be necessary. So you would, educate the client or their partner, if you're going to participate in sexual activity, be sure to wear a condom. That's where the patient teaching comes in handy. And then some antibiotics can cause photosensitivity, so wear sunscreen and avoid sun exposure. And also you would tell them wear long sleeves, long pants, sunglasses, sunscreen, things like that. And then no alcohol because a lot of these antibiotics, like mainly all of them, um, are very hepatotoxicity. So very, very hard on the liver, not too good on the liver. So no alcohol because we don't want two things adding to that hepatotoxicity, adding to impact our liver. And then empty stomach for some. Yeah, so empty stomach for some, and then some of them you should. So the clients need to take food to prevent GI upset like nausea and vomiting. All right, so now we're actually going to get into the antibiotics. So we have macrolides. So your macrolides are your azithromycin, erythromycin. So indications are bacterial infections, and you would use this medication if the client has a penicillin allergy. And then just to note, this medication is not effective against MRSA. Mechanism of action, it basically inhibits protein synthesis, which means it basically just inhibits protein production. And you need proteins for a cell to live, for a cell to survive, replicate, things like that. So it inhibits that from occurring. So by doing that, it slows down bacterial growth. So this is bacteriostatic because you have some medications that are bacteriostatic and then you have other medications that are bactericidal. This one is bacteriostatic. So it's basically if bacteria cannot make proteins, they cannot grow and they will simply just die off. So it slows down the bacterial growth. And then you have other medications that are bactericidal, which we'll get into, but just know that some of them are bacteriostatic, some are bactericidal, which we'll go into later. Side effects, GI upset. All of these are going to cause some GI upset, all right? Dysrhythmias, you just remember it by saying, okay, it's going to throw off the QT interval. And that's just known as torsatus depointis. Don't really pay attention too much on that. But you have a side effect of ototoxicity, rash, prolonged QT interval. So that's where the dysrhythmias come in. Hepatotoxicity, big liver toxic. A way to remember saying is okay, it throws liver away, it throws the QT interval away. All right. Patient teaching, take on empty stomach with a full glass of water. Nausea and vomiting are common. That goes with a lot of these. Nausea and vomiting, GI upset is pretty common. All right, then you have your lincosamides. So this is like clindamycin. So indications of serious bacterial infections. This has mechanism of action of it inhibits protein synthesis. Remember what I said up here. If it inhibits protein synthesis, it basically just slows down bacterial growth. If the bacteria can't make proteins, they cannot grow, and they will just simply die off. But it can be bactericidal or bacteriostatic, and that just depends on the concentration that this client is given. All right. Side effects: GI upset, diarrhea, super infection. Right. You tell that client to um, finish the whole course, things like that. Black box warning: it can cause C. diff, so you want to monitor for diarrhea. Nursing care: these go hand in hand, all right? So if it can cause C. diff, what are you going to want to do? Monitor bowel movements. Make sure that they're not too watery or it's getting diarrhea, things like that. Next up, we have our aminoglycosides. So this is gentamicin, tobramycin, neomycin. So if you remember, this is one of the ones that we said are really strong toxic antibiotics. So indications are serious bacterial infections like aerobic gram bacteria, E. coli, things like that. Mechanism of action is going to inhibit protein synthesis. So this one is going to be bactericidal. It's going to kill the bacteria. So like I said, it's a strong antibiotic, so it's bactericidal. That's a little way to remember it. Since it's a strong one, it's going to kill the bacteria. Side effects include ototoxicity, so to the ears, toxic to the ears. So you can end up with vertigo, which is loss of balance, ataxia, which means like they're not walking straight, they're not walking the right way. Um, yeah, so like clumsy movements, things like that. All right, key to remember: gentamicin is the opposite of gentle. It causes ototoxicity and nephrotoxicity. Oh, sorry, I didn't finish that. But yeah, black box warning for nephrotoxicity, which means the kidneys are really toxic to the kidneys, and then neurotoxicity, like I said, like your ears and hearing go hand in hand with your balance and things like that. Okay. Um, Nursing care: monitor patients for tinnitus and hearing loss. So remember, tinnitus is that buzzing in the ear, ringing in the ear, and then also to monitor kidney function. So if the creatinine is greater than 1.3, the BU1 is greater than 20, and you're also want to do a urine analysis. And peak, you want to check 15 to 30 minutes before next dose. Trough blood levels should be 10 to 20. And you always want to look at these because you just want to make sure that the last dose is out of the system before you give another dose, because then it's just going to be even more toxic for the client. And you have like a double dose in them that's really toxic to their kidneys, um, autotoxicity, vertigo, all things like that. Okay. And then you can administer IM or IB. And like I said, it is IV site strong. So you want to look at the IV site. You want to make sure that there's no erythema, which means redness. You want to make sure that there's no swelling, redness, swelling, warmth. You just want to check for that just to make sure that there's nothing happening there at that site. Okay, so remember that one's a really strong one. This one's important. The ones I put red stars on are really important. Um, Next up are glycopeptides. So this is going to be vancomycin. This one is super, 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 super important. This one, like I said, was one of your other strong ones. So this one is also given for serious bacterial infections, also given for antibiotic-associated C. diff. Mechanism of action is going to destroy the bacterial cell wall, causing cell death. So like I said, this one is also another strong one. So just think, if it's really strong, it's going to kill the cell wall. It's going to kill the cell. Okay? Really strong, kill the cell. All right? Side effects: autotoxicity, nephrotoxicity, infusion reaction. So by the infusion reaction, like I talked about before, is known as red man syndrome. Oral, also known as vancomycin flushing syndrome. The person just looks really red. So if you really like um put this infusion through the IV really fast and you're not really paying attention, this can happen. So when if you're given this medication, you really want to pay attention for this. So don't do a rapid infusion. Do like a slow infusion for an hour. Um, so hypotension, flushing of the face really red, pruritus, which means itchiness, a red rash on the face, the neck, the chest, the extremities, and it can also have a tachycardia. Um, that can happen. That's a red man syndrome for you. Um, sorry. Um, and they can also end up with phlebitis, which is just at the IV site, you can end up with like vein inflammation, um, which can happen at the IV site, which again you want to monitor for. Nursing care, you're going to want to monitor trough levels like 10 to 20 and possibly peak levels because you just want to make sure that the last dose is out of the system so you can administer this new dose. Um, so the dose may need to be adjusted depending on creatinine levels. So again, creatinine is a blood level that basically tells you how the kidneys are doing. So it may have to be adjusted if the kidneys aren't doing too well. So if an infusion reaction occurs, you're going to decrease the infusion rate per order. So that's like a critical thinking question if your professor asks a question like that. So say they ask a question and they say, okay, you have a red man syndrome. Say the question is basically saying that the client has red man syndrome. They have all these signs and symptoms of hypertension, flush, and pruritus. What are you going to do first? You're going to decrease the infusion rate, or even okay. So this can happen. You're going to decrease the infusion rate per order. That's the first thing you're going to do. All right, and let the doctor know. And then again, you're just going to want to monitor the kidneys because we have that nephrotoxicity. Okay, so this one's a really important medication. Definitely remember this one. Your penicillins. Penicillin is a really, really, really big antibiotic just because a lot of people are prescribed this medication, and also a lot of people can be allergic to this medication. Penicillin G, IM, a big one. Amoxicillin, a big one. This one's by mouth. You're gonna learn about, a lot of like bacterial infections in pediatrics where, amoxicillin's used a lot. It's like this pinky medication liquid. Indications are bacterial infections. The mechanism of action is going to weaken the bacterial cell wall, causing cell death. So this one is bactericidal. You want to differentiate which ones are bactericidal or bacteriostatic. Contraindications if they have a history of allergies to penicillin or cephalosporin. So these sort of go like hand in hand. So if you saw like the little table of contents I made, the one I was just going over, these sort of have like they go hand in hand. So if they have a history of allergies to penicillin or cephalosporin, then they shouldn't take this medication. All right. So side effects include GI upset. So that includes diarrhea, nausea, vomiting. That's what they mean by GI upset. And then you have allergic reaction, so shortness of breath or a rash. I had an allergic reaction to penicillin. I broke out in like big rash. I had hives all over my body. Like another vocab word, urticaria. Let me just make sure just so you guys can know if that pops up. Urticaria, urticaria. That just means hives. I broke out in hives when I took this medication, like a big hive rash occurring. Super infection can also occur, so like C. diff. So what are you going to want to do? You're going to want to monitor the bowel movements, right? Is it super watery diarrhea? Monitor for that, as well as you have bleeding. You want to monitor platelets. So again, platelets less than 150,000, you're going to want to be alarmed. Also renal impairment. Pay attention to those kidneys. Nursing care, monitor for that allergic reaction. All right. And then monitor bowel function because of the risk of superinfection, and then take with food if GI upset and you want to shake well. Pregnancy and breastfeeding safe. Yeah, this medication is good because it is pregnancy and breastfeeding safe. And then it does decrease the effectiveness of oral contraceptives. So, like I said, you want to educate the patient on that. That like the oral contraceptives are like birth control. Next up, we have extended spectrum penicillin. So this is piperacillin, tazobactam, zosyn. So when this is given IV, when I was on the med-surg floor for my externship, this medication was really, really common. Like, you just always hear the nurses talk about Zosyn all the time. So that's going to be your piperacillin, tazobactam. These guys are paired together, and the trade name is Zosyn. So yeah, this medication is really common on the med floor I was on. So I just like remember it very well now. So indications is moderate to severe bacterial infections like penicillin-resistant bacteria. Um, so piperacillin weakens the bacterial cell wall, causing cell death. Tazobactam inhibits beta-lactamase, an enzyme that destroys penicillin. So that's just mechanism of action of it. I don't know if your professors usually ask questions about the mechanism of action. I don't think I was really tested on that, the mechanism of action of it. But it's there if you want to read it. Contraindications, history of allergies to penicillin or cephalosporins. So like I said, these guys go hand in hand, really. Side effects of diarrhea, superinfection, like C. diff, allergic reaction. You want to pay attention to allergic reaction because it is a extended spectrum penicillin. A lot of patients can be allergic to penicillin, so that's why you want to monitor for it. Okay, you want to monitor for the shortness of breath. You want to monitor for the hives, rash they can break out in urticaria, which just means hives. Then you have phlebitis, so like inflammation of a vein. So basically, when you put that IV in, there can be a reaction there that you want to make sure that it's not occurring, right? Because that can occur. You want to make sure that it doesn't. Also, side effects of hepatotoxicity, like all of these have a impact on the liver. Sorry. And then also you have nephrotoxicity. It's hard on the kidneys. All right. Nearest care, monitor for that allergic reaction, bowel functioning because it can cause a super infection like C. diff. And then you also want to look at your liver and your renal labs. So again, liver labs, your AST, all those things, renal labs, creatinine, BUN, urine output, all things like that. This is pregnancy breastfeeding safely, and this one also does decrease the effectiveness of oral contraceptives. All right, next is your cephalosporins. So like I said, cephalosporins, your ceps, and your silins, they sort of like go hand in hand. They're really similar. These ones, again, and honestly, I don't think these antibiotics are too bad to remember just because they have similar side effects and everything, and they also have their own suffixes, which is great. Like they all have like pretty suffixes which just like follow each other, so it's not too bad. Um, so yeah, this one starts with Ceph. All right. So indications, again, bacterial infections, that's what we're all talking about. Mechanism of action is going to weaken the bacterial cell wall, causing cell death. Contraindications, history of a penicillin allergy. Like I said, these two sort of go hand in hand, your cephs and your silins. Side effects, GI upset, allergic reaction, such as a shortness of breath and like a rash. Super infection, like C. diff. Does not treat C. diff, causes it. So just note that. Patient teaching, do not consume alcohol during therapy. Again, we said this before. You're not going to want to have alcohol because all of these are really hard on the liver. You're not going to want to take alcohol because alcohol is hard on the liver too. Pregnancy and breastfeeding safe. And your substance they cannot be mixed. That's just a note on that. They're similar, but they cannot be mixed. Next, you have your carbapenems. I don't know if I was tested on this one. I didn't put stars on it because it doesn't stick out to me as I was tested on it. But it's here if you want to read through it. If your professor told you that it'll be on it, your final and look at it. Drugs, imipenem, silistane, meropenem, they all end in penem, so not too bad. The suffix is common. Indication, serious bacterial infections, broad spectrum. Don't focus too much on the gram-positive, gram-negative of it. Mechanism of action, destroys bacterial cell wall, causing cell death. Contraindications, possible cross-sensitivity in patients with penicillin or cephalosporin allergy. Side effects, GI upset, rash, super infection, seizures. So this one has a side effect of seizures. That's a new side effect that we're seeing, right? Next, fluoroquinolones. This is another big one. Note that. These end in floxacin. So that another common suffix, so not too bad. Indications, bacterial infections like UTIs, bone joint infections, respiratory infections, um, anthrax. So I was studying for my community ATI, and the only really antibiotic that can treat anthrax is ciprofloxacin. That's the main medication. So I'm sort of like reviewing with you guys. Um, anyways, you can get this for UTIs, bone joint infections, respiratory infections, and anthrax. Anthrax is a bioterrorism thing which can be inhaled, and it can cause like sepsis, shortness of breath, and all these things. But a 60-day course treatment, I believe, is how they treat it. So a little bit about that. Mechanism of action is bactericidal. Side effects, diarrhea, superinfection like C. diff, or a vaginal yeast infection. So again, superinfection is like like remember what it was like. You have normal bacteria within your body, but now it's protruding through other organs and things like that. Photosensitivity, increased liver enzymes. It does have a black box warning. Oh my god, write this down. I remember this from last year. Really important. Tendon rupture, especially for those who are less than 18 years of age. Tendon rupture. Write that down. Star that. Nursing care, monitor bowel movements because it does have that risk of diarrhea and superinfection like C. diff. Make sure it's not too watery or anything like that. Patient teaching, wear sunscreen. Write that down too. Wear sunscreen. Sure fluoxetins. Take on an empty stomach with a full glass of water and report muscle pain because that might mean like a tendon rupture. All right, it's important. Next, you have your sulfonamides. I've talked about sulfonamides in other chapters just because a lot of medications you can't take with sulfas. Drug is trimethoprim, sulfamethoxyl. Indications, bacterial infections like UTIs, bronchitis, pneumonia, otitis media. Mechanism of action, it inhibits bacterial folic acid synthesis, or another word for synthesis is production. So it's like a little bit easier to remember when you put production there. Contraindications if there's a sulfa allergy. Side effects include GI upset, blood dyscrasias. That means like low white blood cells, low platelets, low red blood cells. Photosensitivity, crystalluria, which means your crystals in the urine. You never want crystals in the urine because that's going to mean like an increase in your urine specific gravity. Stevens-Johnson syndrome, and then urine specific gravity high, like I just said. Excuse me. And then you have a nursing care of you want to monitor your CBC levels because, like I said, you have that side effect of blood dyscrasias, which means low red blood cells, low white blood cells, low platelets. So that's why you're going to want to monitor your CBC levels. Patient teaching, wear sunscreen because there's a risk of phototoxicity, and increase fluid intake to prevent that crystalluria, to prevent the crystals in the urine, to prevent that urine-specific gravity from increasing. Remember that normal range is 1.03 to 1.003. It's not pregnancy safe because there's a risk of kernicterus. You guys will learn this next semester, but kernicterus is a form of jaundice in which the jaundice travels to the brain and can cause brain problems of the baby. So, but you'll learn that next semester. Next up, you have your tetracycline. So that's doxycycline, tetracycline, another important medication. This treats a wide variety of bacterial infections. Like I took this one for acne. They can also take it for like Lyme disease, sexually transmitted infections, chlamydia, gonorrhea, things like that. Rocky Mountain spotty fever, broad spectrum. So it's used for like a lot of different bacterial infections. Mechanism of action, it basically prevents the protein synthesis or the protein production, which basically inhibits the bacterial growth, so it's bacteriostatic. Contraindications in pregnant women and children less than 18 years of age. So side effects of GI upset like nausea, vomiting, diarrhea, things like that. Tooth discoloration in children and fetuses. Highlight that, okay? And then hepatotoxicity, like all these are really liver impactful. Photosensitivity, superinfection would be C. diff, like I said, interactions decreases the effectiveness of oral contraceptives. So you gotta teach your patient. Wear sunscreen, and then dairy products, foods and calcium and iron and acids decrease absorption. Um, so yeah, when I took this medication, the nurse told me to um don't have dairy like with this medication because it will decrease the absorption, which basically like the drug's just not gonna work. It's not gonna do its job if you're gonna have dairy products or calcium, iron, or antacids with it. Take it on an empty stomach with a full glass of water, but it just depends. I mean, I used to get really nauseous and felt like throwing up when I used to. So I told the nurse practitioner, and she said, okay, then you can take like a little bit of food with it. So it just depends on the client and the dose, how high the dose is. Sit up 30 minutes after taking. Do not lay down because this can cause induced esophagitis, which can cause like heartburn, GERD, things like that. So always sit up. Don't lay down because it can cause problems with that. Next, we have urinary tract antiseptics. So this is like nitrofurantoin. This is given for urinary tract infections. So it inhibits bacterial enzymes involved in the synthesis of DNA, RNA, and cell wall protein. So you have GI upset, pulmonary toxicity, peripheral neuropathy, so that's like that numbness, that tingling, brown discoloration of urine, and blood dyscrasias. So remember, blood dyscrasias is important because that means like low red blood cells, white blood cells, and platelets. Patient teaching is to take with food, and it is contraindicated in pregnancy. Sorry. Um, all right. Mm, mm, mm. Next, you have antibiotics, antiprotozoal. Metronidazole is important. This one is given to treat C. diff. I know this one mainly to treat C. diff, but it can also treat sexually transmitted infections too. It inhibits DNA and protein synthesis and is effective against anaerobic bacteria. It does cause GI upset like nausea, vomiting, diarrhea, metallic taste, dark urine, dizziness, headache, Stevens-Johnson syndrome, ataxia, which is an adverse effect. So basically, it like decreases like this muscle tone, and they like can't really walk right. They get like they walk wobbly. And this one can also have a side effect of seizures. And patient teaching: do not consume alcohol. That's the main patient teaching for this medication. But this goes for all of them, right? Because of that hepatotoxicity. But with this one, if they take alcohol, this medication, violent vomiting and cramping, and they should report any new rash or skin peeling. Sorry for that typo. But skin peeling means the Stevens-Johnson syndrome, like I was talking about before. Then you have anti-tuberculosis agents. These are really important. I don't know if I was tested on this one last year, but this one is so important to know just because this came up for me in community for ATI, probably even like NCLEX. So these drugs are like rifampin, isoniazid, which is INH, or pyrazinamide or ethambutol. This when a client has when a client when a client has tuberculosis, they have to be on this medication for 6 months up to a year, um, because they just need to take it for that long and they need to have compliance. Side effects for each one: rifampin, red orange secretions, GI upset, and decrease the effectiveness of oral contraceptives. INH, neuropathy, is like the numbness, tingling, and it's caused by low vitamin B6. Arthralgia, which means joint pain. Ethambutol, changes in vision, eye exams. Black box warning, hepatotoxicity for all of these. Okay? Nursing care and monitor for signs of liver damage, report visual acuity changes, and get vision screening, use an alternative method of birth control. All right, so like all the things I said, all right? Non-limit acetaminophen. Okay, remember that, okay? Acetaminophen, which is your generic name, your trade name is Tylenol, very hepatotoxic, very damaging to the liver. Then you have your antifungals. Your fungals are always going to end in azole, or you have something that's a little bit different, but mainly they're going to end in azole. Ketoconazole is your main one. Indication: systemic fungal infections like nail fungus or fungal infections, or like even like skin fungus. a lot of things can cause fungus, like sweat or like even water in the summer, things like that. Mechanism of action: disruption of fungal cell membranes. These are your medications. The main one is ketoconazole, hepatotoxicity, GI upset, arrhythmias. Okay, then you have your antivirals. Um, I don't think I wasn't tested on these, but they are here if you want to read it. And if your professor said that it'll be on your final. But your virals and in Burr, you can give it for like herpes or chicken pox, things like that. Or even influenza. This was like on my community ATI. It was like a question. You give antivirals. So say someone was exposed to influenza. There's different strains of influenza, but they were exposed to influenza. What medication would you give them? You would want to give them an antiviral. You're not going to want to give them the flu vaccine or anything like that, just because it doesn't provide, or you wouldn't even want to give them immune globulin because it's not going to provide. Um, sorry, my mind always goes blank. But it's not going to provide immediate protection. Um, so that's why you're going to want to give an antiviral. That's going to provide that um, immediate protection for you. Oh, and it says right here, administer within 48 hours of influenza symptom onset. So that's something I learned by just like reviewing the other day, which is interesting. So it's going to be like these, but yeah, that's where antivirals come into play. They can provide like um, more immediate help with influenza, even chickenpox and like that. All right, and then you have your antiretroviral agents. Um, like HIV. So if your professor told you to look at it, just look at these. I was never tested on the heart medications, but if you guys just want to make sure that that's there, mainly I would say focus on what your professor's telling you, but the ones I start are the ones that are like really common. You're gonna see a lot if you work on a med-surg unit in the summer or do an externship. These are the ones you're really gonna see and hear of or see in the chart. And then just really focus on your patient teaching and your nursing care. Really important. And look up here as well, helps you differentiate. I try to color coordinate because that helps me. Um, but yeah, if anyone has any questions, feel free to reach out about anything. If you guys need help with anything, let me know. And then I put some resources that helps me study. And that's that. So if anyone needs help, feel free to reach out. Bye.